Thank you, Hisham, for the opportunity to present, and thank you to the University of Birmingham and everybody who's a part of the IGI for supporting our research. As we heard Carrie express so powerfully, COVID-19 has impacted on patterns and rates of domestic violence. I'm going to talk about sexual violence, another form of GBV that, like domestic violence, actually has very limited data to support what kinds of increases are happening around the globe. I study sexual violence in a range of contexts, including the global north and the global south. And today I'm going to talk about my work in Kenya, which is led by a grassroots sexual violence survivors movement. They're pioneering a new survivor-centered approach that allows real-time documentation of sexual violence incidents. The approach has already provided us with some very important insights about patterns of violence during COVID-19. While sexual violence can happen anywhere in the world, and indeed prevalence rates are striking everywhere, it happens more often to women and girls from low-income families who are living in developing countries and who are in displaced, conflict-ridden communities. Prevalence is high in these contexts, and yet the response is usually inadequate. As a result, sexual violence morbidity, mortality, and its effects on economic and social well-being are major obstacles to sustainable development. Around the world, sexual violence is also rarely prosecuted, and this is true especially in developing countries. This is for a host of different reasons. Governments, for example, don't routinely collect data about incidents, so myths and stereotypes about rape and survivors persist. Victims usually don't report, and this is owing to fear of stigma by their communities, as well as fear of reprisal and mistrust of authorities who themselves are often perpetrators. Survivors may also be told that they have to pay for medical supplies, report forms, and we've even heard of instances where they've been asked to pay for petrol for the police to investigate their case. All of this should not happen. It's unaffordable for survivors. And without medical legal evidence, cases can't be prosecuted. There's little to no role for survivors' testimony about their experiences in many countries around the world, including Kenya. Their testimony is instead subjugated to medical and forensic evidence, which is deemed necessary to corroborate their account. The trouble is that these other forms of evidence are usually not available. So my work has been focusing on how we could preserve and protect the accuracy and reliability of survivors' testimony and statements, or their memory evidence, and increase its use and value. We could use memory evidence to study the nature of sexual violence and improve the evidence base in case prosecutions. And by increasing the value of memory evidence, we can help tackle gender inequality. By inviting their testimony and statements, what we're doing is amplifying the experiences of survivors, which more often than not are women and girls, and recognize them as human rights actors instead of as victims. Turning now to Kenya, there are two population-based surveys with nationally representative samples. They provide estimates of sexual violence that are higher than what we see worldwide. In Kenya, the occurrence is 1 in 4 girls and 1 in 7 women. What determines the variation that we see across surveys is an interesting question. The lower rate for adults may reflect a decreased willingness to report or identify experiences as sexual violence. Nevertheless, both rates are higher than what we see elsewhere. Population-adjusted prevalence of sexual violence around the world is estimated to be on the order of 8%. The cumulative harms that survivors face as they attempt to access services and justice in Kenya has been compounded by the pandemic. In Kenya, schools were closed on March 20th, and a dusk to dawn curfew came into effect on March 25th. Abiding by the curfew severely impacted on people's livelihoods. People in Kenya, they live hand to mouth. And within 3 weeks, as shown on the map, there are more than 2,500 incidents of police using violence to enforce the curfew. 2 months into the pandemic, in terms of COVID-19, there were 1,600 confirmed cases and 58 deaths from COVID in Kenya. Meanwhile, there were 50 rapes perpetrated by police officers and 8 deaths of civilians at the hands of police. Today, there have been about 40,000 confirmed cases of COVID-19 and 735 deaths. Being led by our partners, we started documenting cases across Kenya as soon as the emergency measures were instituted. The cases were documented by human rights defenders, and we documented all forms of violence, and regardless of survivor gender. There were often great risks posed to the gender defenders in terms of their own well-being, and this had nothing to do with COVID, but rather because of the violence that they were facing in matters of curfew enforcement. I'd like to introduce you to Wangu Kanja, a very good friend of mine on the left, who is a powerhouse and an inspiration in Kenya. She's leading our data collection. Wangu suffered a horrific carjacking incident and rape several years ago, and she was met with indifference and disrespect by authorities. And out of her struggles, out of her rage, she launched the Wangu Kanja Foundation, which assists survivors of sexual violence with a range of services and programs. She also recently launched the Kenya Sexual Violence Survivors Network, which is comprised of survivors who are also gender defenders. It's really important also to point out that she has launched an app, and this mobile application is recording incidents all over Kenya. The government does not routinely measure sexual violence, and of course, what gets counted counts. In sexual violence, though we know it's a problem at scale, it's only considered as anecdotal by duty bearers unless you could show the experiences of people happening as a whole in the form of country-specific statistics. The network, because of their use of the mobile application across all 47 counties in Kenya, the network now holds more data about sexual violence incidents than any national survey that's ever been conducted in Kenya. We wrote a preliminary report about experiences that people were going through during the pandemic and trying to access services and justice. You can access the report in the policy brief at this website. The report, it encompasses the experiences of the first 100 survivors that we interviewed, but to date, we've interviewed 1,000 survivors in collaboration with my colleague Lisa Smith at the University of Leicester and to the Rape Survivors Network in Kenya. And what I'm going to share with you today are the first 400 cases that we've analyzed. When we look at our sample of children, the majority of them are girls. When we look at their experiences compared to the National Violence Against Children survey that was conducted some years ago, we find that the time of day in which the attacks are occurring is really similar. But if we look at the age of survivors during the pandemic, they're considerably younger. They're 4 years younger on average. They're age 12. If we look at the context in which these incidences are occurring, it's often occurring by a neighbor that's often perpetrating violence under the guise of offering educational assistance, such as coming to the perpetrator's house to use the internet or a mobile phone. Those are the circumstances in which we're seeing more cases occurring. And as a result, we also see that more perpetrations are happening inside the perpetrator's home than compared to before the pandemic. In terms of adults, again, it's mostly women that were reporting to the human rights defenders. The time of day in which instances are occurring is all over the place. Some are happening during the day, some are happening in the night. We see many cases of multiple perpetrators. And unfortunately, there's no existing national survey data to be able to tell us whether this is a pattern that has changed. We also see that more survivors are being attacked in different types of locations, we think. But what the data are revealing is that women are under threat everywhere. They're under threat in their home with incidences of perpetrators knocking doors down in the middle of the night, to where they try to use the bathroom in the middle of the night, which requires leaving the home because there aren't any bathroom facilities in these homes in many cases, and they're being attacked on deserted streets. Or they're leaving for work in the pre-dawn hours and getting attacked by perpetrators because, again, there's no one around due to the curfew that's in place. We find that there's victimizations happening by people who are known to the survivor, as well as victimizations that are happening by people who are total strangers. So women literally appear to be under siege in Kenya. So coming out of these findings, We have several recommendations that we like to make. We think, like other emergencies, like the Ebola crisis that happened in the DRC and Sierra Leone, children need alternative safe venues during these times. And we know that pregnancy, for example, has increased dramatically, teen pregnancies increased dramatically in Kenya, as is sexual exploitation and other horrific violations that are happening to children. And these alternative venues can be supportive and prevent these atrocities from occurring. We also need locally attuned measures to ensure that there are access routes for sexual and gender-based violence reporting, which often were being closed down during the curfew hours. We also think it shouldn't be illegal for survivors to access medical legal services during lockdowns. They need to be able to attain those emergency life-saving services during the pandemic. And finally, real-time data collection is an absolute must. We need to identify crime hotspots so that we could prevent these crimes from occurring. We need to understand the nature of violence that's occurring to dispel myths and stereotypes. And we need to make sure that we know when services are not accessible and provide alternative service routes. And we could do this with mobile applications, and we could do this with the Survivors Network and human rights defenders that all over the world are being blocked by the simple fact that they don't have mobile phones and access to data. So those are some simple ways in which we can increase our knowledge about sexual and gender-based violence and prevent these actions from occurring. Thank you, Sham. Over to you.